Radius and ulna are the two forearm bones. In anatomical position, the radius is lateral and shorter than the ulna. Each of these bones has a proximal end, shaft, and distal end. The proximal end of the ulna articulates superiorly with the distal end of the humerus and laterally with the radius. The articulation with the humerus is via the olecranon process posteriorly and coronoid process anteriorly. Laterally, the proximal end of ulna articulates with the head of radius via radial notch. A smooth, rounded concavity on the lateral part of the coronoid process. Also, there is a tuberosity of the ulna inferior to the coronoid process for the attachment of the tendon of the brachialis muscle. The shaft of the ulna is thick and cylindrical proximally, but it diminishes in size as it continues distally. Supinator crest and fossa are the distinguishing features of proximal part of the shaft of ulna. Supinator crest is a ridge inferior to the radial notch on the lateral surface of the ulna shaft, while supinator fossa is a concave depression between the supinator crest and the distal part of the coronoid process. The crest and fossa provide attachment to the deep part of the supinator muscle. There is also interosseous border on the lateral side of the shaft for the attachment of the interosseous membrane that connect it to radius and divides the forearm into anterior and posterior compartment. The distal end of the ulna is small and narrow, but with an abrupt enlargement as the head of the ulna and a small, conical ulnar styloid process. The head of ulna fits into ulnar notch on the distal end of the radius. Note that ulna does not reach the carpal bones, and therefore does not participate in the formation of radiocarpal or wrist joint. The radius is located lateral to the ulna, and shaft widens distally, unlike the ulna. The proximal end has a head, neck, and tuberosity. The head is concave and articulates with the capitulum of the humerus during flexion and extension of the elbow joint. The head of the radius also articulates with the radial notch of the ulna. The neck is the constriction distal to the head. The radial tuberosity is distal to the medial part of the neck and separates the head and neck of the radius from the shaft. The shaft of the radius increases in diameter distally. The medial part forms a concavity, the ulnar notch, which accommodates the head of the ulna. The lateral border of the shaft of the radius ends distally as the styloid process of the radius, which is larger than the styloid process of the ulna. The distal end of radius also has a bony prominence, posteriorly known as dorsal tubercle of the radius. Laterally to this tubercle is the groove for the tendons of extensor carpi radialis longus and brevis. Similarly, on the medial side of the tubercle is another groove for the tendon of extensor pollicis longus. In addition, more medially close to the ulnar notch is the groove for the tendons of extensor digitorum and extensor indicis. There is also an articular facet on the inferior surface of the distal end on the radius laterally for the scaphoid and medially for the lunate. If this video is helpful, consider subscribing or clicking the like button.